Hi everyone, it's Colleen from Let's Talk About It. It's been 1 month since I had my occipital nerve decompression surgery, and I'm doing pretty well. The back of my head is looking pretty good, I think. So far, so good. So where am I? Well, I do have pain around my head still. It's manageable, except I still have to use that airplane pillow because anything that touches my head, it hurts. Let's see. Driving is okay. I can turn to the left, I can turn to the right. This is rough, and this is rough, and this is new. Try these if you have this condition. That's new. That's tough too. So I am driving every now and then. I did have to go to the hospital because my daughter had some medical stuff, and I had to hang out with her for 2 days in the hospital, which was really tough, to be honest. I was completely exhausted. So the scar's doing okay. I do have head pain. It's manageable. I do take medicine at night to sleep because I'm still having a hard time. I do take Tylenol and ibuprofen during the day because I'm still having a hard time. What I'm noticing is driving, like, made my head hurt a lot more, and I was exhausted. Of course, it didn't help that one of the streets that I went on was cobblestone. Oh my gosh, just take my head in your hands and shake it. That's what cobblestone streets do. They're the work of the devil. So anyway, I did start physical therapy. My doctor has me starting physical therapy to strengthen my neck. Very interesting. I have really, really, really tight and painful traps. My temporal muscles, I don't know what they're called. He has me doing this several times a day. It actually hurts. It's really tender to touch these muscles around my temples here. And then he was even like working on muscles in here, which were also really tender. I was shocked. I'm like, why does that hurt so much? Why is that so tender? You know, again, this goes up into here, right? So it's all connected. So I was really surprised, but yeah. So I just really had the first day of physical therapy where we did a lot of measurements. You know, we did even some strengthening stuff with my arms and my hands. It's going to be really tough. Well, interesting. Definitely strengthening my neck makes sense. But remember, I have vestibular migraines, so I have some balance issues. My brain injury doctor is looking for me to start vestibular therapy in late April or May, like let this calm down a little bit. You know, this surgery that I had just kind of takes care of the pain in the back. Doc said I'm looking at like literature, like 80% of people get 50% or more of pain relief. So that's the hope. That's pain. But the other things, super sound sensitivity, light sensitivity, headaches, balance issues, those things are from vestibular migraine. So that's not going to be dealt with this surgery that I just had. The hope is that after this calms down, I do a little more healing, then I go into vestibular therapy and we'll see how we do. Last time I did it, I had to stop because I was literally like throwing up every day because the vestibular stuff was making me really nauseous and really sick. So I'm getting around. Obviously, the more I do, the more I walk, the more steps I use, the more I drive. Anything like that is really difficult. Doc said I really should not be picking anything up more than 5 pounds still, which is a challenge. But we have to be careful because we don't want me to get a neck strain. But I am doing laundry. I am filling up my dishwasher. I cannot take out the trash. I cannot take out recycling, obviously, that kind of stuff. I do some cooking, but I can't carry a pot of water over to the stove. I have been to a store once and it was okay, but I can't really buy much because I can't lift much. If I do, then I leave it in the car and I wait for someone to take it out of the car for me so I can put it away. So for the most part, I think I'm doing okay. Sleeping is still difficult. I have to sleep with the airplane pillow, but you know, it's okay. I am unbelievably fatigued, unbelievably fatigued. I don't know why. I don't know if I have something else going on. I do have thyroid disease, so maybe my meds are off a little bit. Maybe it's an iron deficiency. I don't know. I called my doc to ask if I can have some blood work done to determine if there's something else going on, or is this like normal? Like, should I be this tired? You know, if I do anything, I have to take medicine, I have to sleep, and then the next day I'm like zonked. So I don't know. I'm not really sure what that's about. The pain that I have is like throbbing. Usually all day I have maybe a level 3, 4, like head throbbing, achy all around. And then every now and then I get like a really, I call it it's like a burning pain, like it literally feels like somebody has like a poker on my head. That seems to be where a lot of the work was done, based on what the doctor said to me. So I don't know what that is. I don't know if that's just the surgical site. I don't know if it's the nerves, because as far as I was told, the nerves are like numb, and then they start to wake up after like 3 months or so. Pins and needles and then all that, and then we'll see what I'm left with. When I move, sometimes I'm having a lot of pain over here. I just, I think you just really have to tune in your body and like, how do you feel? What's really happening here? So sometimes it's a pickaxe kind of pain, but usually it's just a really bad burning pain. If my head touches something, that's like a throbbing pain. That's like a burning, throbbing, holy cow pain. So it's manageable though. I'm definitely managing it. It is affecting my sleep. It is affecting my ability cognitively a little bit, but I think that's pain and lack of sleep, right? I don't know. But I've had cognitive issues from my accident and the brain injury. So, and by cognitive, I mean like short-term memory. I have a lot of trouble, especially like verbal information, new verbal information, where maybe I could hold onto 9 plus or minus 2. I'm like 4. Plus or minus 2. And then what I'm really noticing cognitively, and this isn't necessarily because of my surgery, I'm having a lot of trouble with like analysis and higher level thinking, like using my working memory to like manipulate information in my brain and kind of evaluate, analyze that higher level stuff. I don't know. I'm hoping that comes back. We'll see. But yeah, so anyway, I've been pretty good, and I'm really curious to see how I progress over the next few months. So thanks for coming on the ride with me, and thank you for all your prayers and good wishes and all of those things, because I personally think they're very, very helpful. That kind of energy coming to a person who's trying to heal, I think that energy is really, really helpful. So thank you for that. So I'll check in with you soon. Otherwise, 1 month out from occipital nerve decompression surgery, like, we're doing okay. Have a good day, everybody.